This new research talked about whether eye vision problems are linked to developing ADHD later on. And this wasn't a small study. This is a nationwide retrospective cohort study in Israel that followed medical records from 2010 all the way to 2022. And how they did it was they used anonymized health data from over 1.6 million people. And after careful matching, they analyzed more than 665,000 individuals from the ages of 5 to 30 to answer this question. So they wanted to know if eye disorders are linked to the development of ADHD. So researchers focused on eye conditions like nearsightedness, farsightedness, astigmatism, cross-eyed, and lazy eye. And so all of these diagnoses were made by trained eye doctors, and ADHD diagnoses were made already by specialists using clinical guidelines. So this wasn't based on self-report. So they actually did find that people with eye disorders were about 40% more likely to be diagnosed with ADHD, and they tended to get diagnosed earlier. And this was true across almost every eye condition that they studied. And the link was the strongest in children and teenagers, especially strong in girls. So the important part is that vision problems do not cause ADHD. The authors were very clear about that. And it could be instead a shared brain development, genetics, or even that kids with vision problems were getting monitored more closely. So the big takeaway is that vision and attention are more connected than we realized. And this is helpful for early support. Not labeling, but better understanding how the brain and body work together when it comes to ADHD and the full body. And it's also important to point out that hyperactivity or trouble focusing during vision testing could look like an eye problem. So in some cases, attention differences might influence how those evaluations go. But here's why the study is still compelling, because it included so many people and the statistical associations were very tight and they matched for age and sex. And so the association remains strong. And while it doesn't prove causation, it does suggest a relationship between vision and attention being meaningful.